Now let me talk about surgery in breast cancer. Surgery is basically two main types. First one is where you conserve the breast, which is known as BCS, where we remove only the tumor and leave the rest of the breast behind. And the second type is known as mastectomy, where we remove the entire breast with the normal breast tissue as well as the tumor. In BCS, that has sort of become the standard of care in today's era, because studies have shown that results of BCS versus mastectomy, BCS is equivalent to mastectomy and you need not remove your breast each and every time. However, such things are individualized and you have to discuss this with your doctor. Modern treatments have made it such that even after breast surgery, we can reconstruct the breast to almost its natural shape and size. When we do a BCS, there are specific techniques which are known as mammoplastic reconstruction, such that the defect created by the tumor can be refilled with plastic surgery. Plastic surgery usually in these cases are of two types, where we do local plastic surgery, which is the mammoplastic, or we use flaps from other sides of the body. The most common being the latissimus dorsi flap or the LICAP flap. You can Google about it if you want more information. In mastectomy, we remove the entire breast. So after removal of the entire breast or mastectomy, there are basically two options for reconstruction. Number one is a local flap or the LD flap, which is used for reconstruction in small breasts. And number two is a free flap, which is known as the DIEP flap, which is taken from the lower part of your abdomen and placed over the breast. That gives you an additional advantage of a tummy tuck operation as well. These two result in reconstruction of the breast almost to its normal shape and size as it was prior to the surgery. Later advancements have also helped in creating nipple reconstruction, where we can reconstruct the nipple which is removed, and areolar tattooing, where we tattoo the areola around this part such that a person will not even realize a surgery has been done. Cosmetic surgery basically includes the comparison of the opposite breast, your breast prior to surgery, and creating a new breast in such a way that they are more symmetrical and they look more normal or natural. For that, sometimes we can even place implants of silicone in the breast to help increase the size in those women who have enlarged breasts. In certain cases, we do a reduction of the opposite side to get an equivalence in shape when we do the surgery for breast cancer. This is the latest advancements in breast cancer surgery, and you as a patient or a relative should know about this before you undergo your surgery and be informed whether you need this surgery. One more aspect of breast cancer surgery is the need for chemotherapy. To make chemotherapy more easy and palatable, we do another surgery which is known as the chemoport insertion. A chemoport is a small device we place under the skin in your body. That device carries a catheter or a tube which travels through the vein right till your heart, such that when chemotherapy is given in this device, it travels directly to your heart for better and more effective action and lesser complications such as pain and swelling from chemotherapy that we give from the veins. This is something that is done in majority of patients, and you also should inquire about it. The mammography or mammogram is a simple X-ray that we take of the breast. This is done on an OPD basis, where your breast is compressed between the X-ray films and giving an X-ray of the breast. This is usually coupled with a sonography, where both together decipher and search for disorders within the breast. Majority of the breast cancer patients, along with their surgery, need chemotherapy. I have seen that most patients fear chemotherapy the most, more than even the surgery or radiation or any other treatments. Chemotherapy is basically can be given either prior to your surgery or after your surgery. In very lucky cases, people with very small lesions, even chemotherapy might be avoided, and that is why early detection of breast cancer can be beneficial. Chemotherapy can be given either prior to starting your surgery, which is known as neoadjuvant as I explained earlier, or after your surgery. Usually chemotherapy is given in 2 separate cycles, one of 4 doses of chemotherapy followed by 6 to 8 or sometimes even more doses of a second type of chemotherapy. This is actually a full course, and it is very important that you completely finish this such that best results are obtained. Recent studies have shown that breast cancer is not a localized cancer but a systemic disease. That means the cancer is not only originating in the breast, but in general your entire body is sort of afflicted with that cancer. Hence, chemotherapy is considered one of the most important treatments in breast cancer, sometimes even more important than the surgery itself. So do not ever miss your chemotherapy or do not take it lightly. If you want more information regarding chemotherapy, the types, the subtypes and everything, please let me know, and I will definitely make another video to explain the individual types of chemotherapies and what can be the complications associated with each. One of the other treatments or the next treatment after chemotherapy and surgery is radiation. Now usually all patients who have had breast conservative surgery, radiation treatment is given to the breast because we presume that there may be a few cancer cells remaining. Hence, radiation destroys those few cells that remain in the breast. In cases where the breast is completely removed, sometimes if the stage of the disease is higher, then radiation sometimes needs to be given to the breast as well. Radiation therapy is usually given over a span of 6 weeks. Usually 5 days a week the patient has to go take his dose of radiation for a total of 30 doses. Newer therapies, newer modalities and newer treatments have had changes in these protocols. Sometimes the doses can be reduced as well. So this you have to discuss with your radiation oncologist as to exactly what is the correct protocol of radiation for you. As I had spoken earlier, when we do a biopsy, we also do immunohistochemical analysis. In that we specifically check for ERPR or the estrogen receptor and the progesterone receptor, as well as the HER2 new gene. Estrogen receptor and progesterone receptors are sometimes present in a majority of breast cancer specimens. This is a good prognostic sign for the patient, such that means the patient will benefit from hormonal therapy. Presence of these receptors means that the tumor itself is sensitive to estrogen and progesterone, which are two hormones present in the woman's body. We use hormonal therapy such that we block this estrogen and progesterone action on the tumor cell. Hence, we prevent it from growing and from flourishing. So ERPR means you have to take hormonal therapy for at least 5 years post completion of your treatment for cancer. The second immunohistochemical analysis is HER2 new gene. This is a specific genetic mutation that is seen on the cancer cells. There are special receptors known as HER2 new receptors, which basically are prevented or blocked by the action of the drug trastuzumab. This helps greatly in preventing recurrence and curing from cancer. This trastuzumab therapy might be given for almost a year, and there are various forms and methods or doses in which it is given. Finally, breast cancer treatment in general is an ever evolving field, and hence many times the treatments are catered or personalized based on the stage, the age, the hormonal composition of the disease, as well as the patient desire, patient fitness. Hence, no two treatments are alike. For this post-treatment also there are many groups, societies that focus on breast cancer patients and their well-being. Do not ignore rehabilitation, because after cancer treatments many of the patients have many complaints like swelling of the arm. By the way, did you know this swelling of the arm, which is common in breast cancer patients, known as lymphedema, also has treatments. Modern treatments like microsurgery, physiotherapy, occupational therapy helps in reducing this, and many times these patients also get back to normal. In this short video, I have tried to give you as much information as possible about breast cancer, the latest treatment options, and what all we can do if you are diagnosed with breast cancer. If you have any more doubts, any more queries, please feel free to get in touch with me, send me your questions, or obviously connect with me so I can also help you out in screening out these doubts. To our next cancer and our next video, please stay tuned to this channel.